This demonstration showcases the Kill the Clipboard Initiative, using the eClinicalWorks EHR and the eClinicalMobile application. We'll walk through a scenario with a patient named Jessica Argonaut, born March 15, 1985, who arrives at an eClinicalWorks provider clinic. Jessica brings a Smart Health Link QR code generated from her patient-facing app containing a snapshot of her current health information. eClinicalMobile is a secure mobile application by eClinicalWorks that allows healthcare providers and their staff to access their EHR system via iPhone or Android devices. It is optimized for handheld devices to help providers manage schedules, e-prescribe, view lab results, and capture charges from anywhere. At check-in, the front desk staff opens the eClinicalMobile application and scans the QR code presented by the patient. Jessica's health data is automatically added to her chart in the eClinicalWorks EHR, with no need for manual data entry or clipboard-based intake forms. To review the information that has just been captured, staff or clinicians can navigate to the Prisma module, eClinicalWorks' health information search engine. Prisma normally aggregates longitudinal records from networks such as Care Quality and TEFCA, but in this workflow, it also displays patient-provided data that was received through the QR scan. The imported patient information appears as a PDF document, visible by selecting the corresponding entry. Opening the document reveals the relevant medical history and data Jessica opted to share, now incorporated directly into her clinical record, demonstrating how the Kill the Clipboard Initiative modernizes patient intake and reduces friction at the point of care.